You know that feeling? You're sitting in a perfectly quiet room, but it's not actually quiet for you. You hear something no one else does. And I'm not talking about a ringing sound, but something rhythmic, like a thumping or a whooshing. Well, today, we're diving into a really fascinating medical mystery that starts with exactly that clue. Just think about that for a second. A sound in your ear that's keeping perfect time with your own heartbeat. If that sounds even vaguely familiar, well, you are definitely not alone. And that thing you might be experiencing, it actually has a name. Yeah, it's called pulsatile tinnitus. Now, this is totally different from that common ringing in the ears that a lot of people get. This sound isn't just some random noise. It's a clue. It's like a physical signal from inside your body that's trying to tell you something. All right, so the big question right off the bat is this sound actually real or is it, all in your head? Well, that's the first thing we've got to figure out in this investigation. And believe me, the difference is absolutely crucial. Okay, so most of the time when people talk about tinnitus, they mean subjective tinnitus. That's a phantom sound only you can hear. But pulsatile tinnitus, it often lands in a whole different camp, objective tinnitus. And that means it's usually a real acoustic sound happening inside your body. Get this, sometimes a doctor can actually put a stethoscope up to your neck and hear it too. How wild is that? Now, you can see here, objective tinnitus is pretty rare. We're talking only about 1% of all tinnitus cases. But that's exactly what makes it so important. Because if there's a real physical sound being generated, well, that means there has to be a source. And if there's a source, you know what? We can usually find it. And this, right here, is the really hopeful part of this whole story. Just like this says, these cases usually have causes that we can identify and, even better, that we can treat. The sound you're hearing is just the symptom, it's not the root problem. And that means this is one mystery that, more often than not, actually gets solved. Okay, so let's get into the nitty-gritty. How do doctors even begin to figure this out? Well, just like any good detective, they start by going straight to the scene of the crime to find out exactly where that sound is coming from. And that crime scene is almost always right around your ear. I mean, your hearing system is just incredibly sensitive, and it's packed in there with a super complex network of blood vessels and tiny little muscles. So that sound, it's usually caused by one of two main things. Either you've got some choppy, turbulent blood flow making noise as it rushes past, or you've got tiny muscles contracting over and over again. So we know how the sound is made, mechanically speaking. Now it's time to bring in the usual suspects. I want you to picture this like a classic detective movie, where we line up all the potential culprits behind that thumping sound. We can basically break down the causes into four main groups. Suspect number one, and this is the big one, is vascular issues, so problems with your arteries and veins. But then we also have to look at suspect number two, structural problems, like with the temporal bone. Suspect three is muscular causes, something called myoclonus. And finally, we've got systemic conditions, which are things that affect your whole body. So yeah, these vascular issues are by far the most common culprit. This can be anything from a vein that's gotten a bit narrow, which makes the blood flow choppy and turbulent, kind of like what you're seeing in that MRI, all the way to these really vascular tumors. In any of these cases, it's that irregular, noisy blood flow that creates the whoosh sound that your ear is sensitive enough to hear. All right, next step in our lineup is the muscular suspect. It's kind of wild, but sometimes these teeny tiny muscles deep inside your middle ear can just start to spasm over and over. The medical term for this is myoclonus, and it creates this rhythmic clicking or maybe a fluttering sound. Now, this one isn't always synced up with your heartbeat, but it's another one of those real objective sounds that can often be treated. And last on our list are what we call systemic conditions. This is when something is affecting your whole body. Think about things like high blood pressure or even pregnancy or severe anemia. These can all increase your cardiac output, which basically just means your heart is pumping blood faster and with more force. When that happens, the flow can get so loud that your ears just pick it up, even if there's nothing structurally wrong right there. All right, so we've got our lineup of suspects. The big question now is, how do doctors figure out which one is the actual culprit? Well, it's not guesswork. They have a really systematic toolkit they use to crack the case. The whole investigation really breaks down into three clear steps. First, it all starts with just listening. The doctor takes a really detailed history, looking for clues in how you describe the sound.
Step 2 is the physical exam. This is where they might actually listen to your head and neck with a stethoscope, or do simple things like applying gentle pressure to a vein to see if the sound changes. And finally, step 3 is bringing in the big guns, advanced imaging like MRIs and CT scans that let them literally see the source of the sound.
And here's the really crucial point. This whole process is not a shot in the dark. It's incredibly effective. I mean, look at that number. In over 70% of cases, this systematic approach finds a specific, identifiable cause. That's a huge success rate. And this is the final reveal, the big payoff. Once that cause is identified, there's almost always a direct and effective treatment waiting. We're talking about things like endovascular surgery for an arterial problem, or maybe medication or a stent for a venous issue. It could be surgery for a tumor, or even something like Botox for those muscle spasms. The point is, when you solve the underlying problem, you can often silence that sound for good. So if you ever hear your own heartbeat in your ears, what's the real takeaway here? It's simple. Don't just dismiss it as a weird annoyance. That rhythmic sound is a signal. It's a solvable mystery. And paying attention to that clue, that's the very first step to finding the answer.